decided to get into medication-assisted treatment. Well, the good news is there are more options than ever before. But with so many options, how do you know which is the best fit for you?
The FDA has approved several different medications for opioid use disorder. All of them are proven to decrease use and reduce cravings, but they work through different mechanisms. So what's the right medication for one person may not be the best medication for another. Methadone is the oldest medication available for opioid use disorder. It's been proven in multiple studies to treat withdrawal and deal with cravings. It's only available for opioid use disorder in special federally licensed clinics, and the medication is dispensed rather than prescribed. So early on in treatment, people have to attend the clinic quite frequently. That's perhaps not so good for people that might have difficulties with transportation or work jobs that require them to go out of town a lot. However, methadone is often better for people who have really large habits of illicit drugs. Unfortunately, it can also have more side effects. Buprenorphine was originally available as an orally dissolving tablet, and now is also available as an orally dissolving strip, sort of like a breath strip, and also a long-acting injection. Buprenorphine is a partial opioid agonist, and that means that if you take it when you're in withdrawal, it will treat your withdrawal and make you feel better. If you take it when you have another opioid in your system, it can actually put you into withdrawal. Because of these properties, buprenorphine is actually safer than methadone, but it may not be strong enough for people who have particularly large habits. Its main advantage is that it's convenient. Instead of going to a special clinic, you just go to a specially licensed doctor, who are generally easier to find. They can write a prescription for longer periods of time that can get filled at any pharmacy. The newest version of buprenorphine is the long-acting injectable. That allows patients who have been stabilized on a dose to get a monthly shot, so it dispenses with the need to deal with prescriptions at all. Naltrexone is an opioid blocker. It's been available in a long time in an oral form, but it's FDA approved for treatment of opioid addiction and for cravings and alcohol addiction as a long-acting injectable. Naltrexone doesn't act at all like an opioid, so it doesn't have abuse potential and it doesn't cause withdrawal if you stop taking it. The disadvantage is it doesn't treat withdrawal. In fact, it can make withdrawal worse, so people need to be detoxed before they start this medication. Also, studies tend to show it doesn't make people feel normal as early on in treatment, and so there tends to be a high dropout rate. People really have to stick with it to get the most out of this medication.
Buprenorphine, methadone, and naltrexone. Which one sounds like it might be the best for you? Not every medication is available at all locations, but talking it over with your healthcare provider can help you decide which is the best fit and get you headed toward recovery.